Welcome to Radi Us, our University of Manitoba Radi Faculty of Health Sciences monthly podcast, where you get to catch up on the headlines from the past month and meet our faculty, staff, and learners making news. We'll also be engaging with our Radi community beyond our campuses, so be sure to listen for alumni and partner voices too. The Roundup for the month of May 2025 includes stories about the results of a national research study on aging, spring convocation at Bannatyne campus, and the expansion of the nurse practitioner program, and more. I'm Jonathan Wilson from the Radi Faculty Communications and Marketing team. This year's graduating class of 101 new doctors received their medical degrees at convocation on May 15th. At the ceremony, the university awarded an honorary doctorate to Sister Leslie Sakuman, a Catholic nun who has dedicated her life to helping vulnerable people in Winnipeg. Sakuman co-founded Rossbrook House, a safe place for inner-city children. She also worked to provide programs and housing for Indigenous youth, women recovering from addiction, and newcomers to Canada. Speaking to the graduates, Sakuman said she was recently at her brother's bedside as he neared death in a Nova Scotia hospital. There she saw the impact of a young doctor's compassion. When this doctor heard that the dying man was a huge Winnipeg Jets fan, he took an interest so that he could connect with the man as a person.
The next day, Dr. Burgoyne bounced into the room. "Hey, the Jets beat the Predators last night." I can't tell you what that meant. My brother just lit up. That's a doctor. That's a good medicine doctor. He had no interest in team sports, but he had done his homework and come in and made my brother, he didn't say the disease as was mentioned. He saw the person, and he brought life to my brother.
Sakuman then called on the medical graduates to treat everyone, including marginalized people, with dignity and respect. The accomplishments of Manitoba's newest dentists, dental hygienists, and pharmacists were celebrated at the spring convocation ceremony. The event took place in the afternoon of May 15th at the Bannatyne campus. The Dr. Gerald Dinsnick College of Dentistry class of 2025 is made up of 30 Doctor of Dental Medicine graduates. 6 of the grads earned degrees through UM's International Dentist Degree Program. The School of Dental Hygiene class of 2025 included 26 graduates, and the College of Pharmacy class of 2025 is comprised of 31 graduates who received the Doctor of Pharmacy degree. Dr. Shaylin Gustafson received the UM Gold Medal in Pharmacy for the highest standing in the College of Pharmacy. She will be returning to her hometown in Brandon, Manitoba to work as a pharmacist.
That's a very exciting feeling. It's been a long time coming, a lot of school and hard work that has gone into reaching this moment. And so it just feels really exciting to be able to celebrate with my classmates, the faculty, and my family and friends that are here supporting me.
Dr. Alyssa Morris was drawn to dentistry because the profession brings together art and science. Looking back over the past 4 years of dental school, she is glad she chose UM.
We had such a good clinical program. I am coming out of school feeling quite confident. So I think that it was good that we got a lot of clinical experience. We had a small class size, so everyone was really able to help each other out.
Spring convocation isn't over yet for the Radi Faculty of Health Sciences. The convocation ceremony on the afternoon of June 5th at the Fort Garry campus will include nursing, midwifery, and interdisciplinary health program students. 2025 marks the halfway point of a major 20-year Canada-wide study on the complexities of the aging process. Since it was launched in 2015, the Canadian Longitudinal Study on Aging, or CLSA, has seen over 300 studies published using its data, including from researchers at the Radi Faculty of Health Sciences. Dr. Kara Brown, an associate professor of occupational therapy at the College of Rehabilitation Sciences, has been working with the study for 3 years, moving into the principal investigator role in 2024. She said some of the most influential publications so far have been about loneliness and social isolation.
And actually through the pandemic, they did some special data collection to learn about the pandemic experience. And that's where we've had some of the learning around how critical social engagement is. That's where we've got some of that hard evidence on how critical social engagement is to our well-being and health. Just just as much as, there's been a big emphasis on physical activity for the last 30, 40 years. And now we're seeing that really, that's one, it's an important piece of the picture, but that social engagement, we all learned that through the pandemic, but we are really able to show that evidence.
Brown said the CLSA follows 51,338 individuals from across all 10 provinces. has played a major role in the project, hosting one of 11 data collection sites and 4 telephone interview sites located across Canada.
When they first recruited all the individuals were between 45 to 85. So again, so that we can see the old aging and middle age, what it's like to move into aging. And so the plan is to continue to follow these individuals for another 10 years. So we're halfway through the study and they get full. We have data collected every 3 years. So data was collected when they were first recruited. And then every 3 years, we do another set of data collection.
Pediatrician scientist Dr. Peter Hotez, who studied anti-vaccine activism in the U.S., spoke at an event at the University of Manitoba in early May, hosted by Dr. Gillian Horton, an associate professor of internal medicine at the Max Rady College of Medicine. Hotez says that vaccine skepticism has become the new normal in the U.S., even within the government, and is concerned about the similar dangers it poses in Canada, especially with the recent spread of measles. He spoke with CBC Manitoba.
And I do worry that a similar movement could be underway in Alberta and possibly neighboring Manitoba, which is one of the reasons that I'm here to see, what we can do to get out really important health information on both the safety of the MMR vaccines, which is the measles, mumps, rubella vaccine, one of the safest vaccines that we know about, one of the most effective vaccines that we know about, and to also debunk this idea that you can compensate for not getting vaccinated with this phony baloney cocktail of budesonide and vitamin A and clarithromycin, which is the kinds of things, tragically, our Health and Human Services Secretary has been talking about.
At the event, Hotez signed copies of his recent published book, The Deadly Rise of Anti-Science, A Scientist's Warning. It was Navnor Randhawa's first ever research project, and she was named one of the 3 winners at the Dr. Gerald Nisnik College of Dentistry's annual poster competition. The third-year dental student appreciated winning.
It felt really good to win because it kind of, it's a lot of work to do, like juggling like schoolwork and then research. So having that win was almost like a cherry on top, and it really was sweet.
Randhawa was one of 16 students and residents who presented their posters at the RBC Convention Centre during the Manitoba Dental Association's annual convention last month. The 2 other poster competition winners are Gary Goel, a second-year Masters of Oral Biology student. His research looked at the Mexican tetrafish as a model to study the human inner ear hair cell. And Dr. Braden Patterson, a second-year resident in oral and maxillofacial surgery. He looked at a case study of a complex jaw surgery. Randhawa's research focused on evaluating how often the initial diagnosis of an oral lesion made by a dentist, specialist, or oral pathologist matched the final diagnosis confirmed in the lab. The study reviewed 217 cases that were biopsied at the Dr. Gerald Nisnik College of Dentistry clinics. Randhawa found that the overall agreement rate between what clinicians observed and what was confirmed in the lab was 67%.
So lots of literature have commented rates which are lower, but there's also some studies that have commented higher clinical rates. But you always have to look at them and see what their parameters were, because our parameters are very to the direct. Did we get it right or no? Whereas other people are like, okay, well, was it in the right category? So that can alternate. So, I was very careful during my thesis that let's make sure we're recording all that.
While doing a literature review, Randhawa didn't see any similar research happening in Canada. She said it would be interesting to see how the study's results compare to clinics at other Canadian dental schools. This year, Indigenous students are graduating from nearly every health program at from dentistry and medicine to nursing and rehab sciences. Before their convocation day, Indigenous grads were honored at a special celebration organized by Angomazin Education, which is part of the Indigenous Institute of Health and Healing in the Rady Faculty of Health Sciences. Chantel Daniels, director of Angomazin Education, said it's a welcoming and supportive place on campus. It helps Indigenous students to achieve their academic potential and graduate into health careers.
So we support our learners not only academically but mentally and emotionally as well as culturally, and so we also provide a safe space for them. So they are community, they're each other's communities, and so the senior learners mentor our junior learners. Community is everything for us, and we lean on each other to be able to make it through these programs.
At the celebration, Daniels presented each Indigenous graduate with a stained glass eagle feather. She told the grads that they have shown strength, resilience, and commitment, and are now ready to bring positive change to their communities. To address the growing need for healthcare professionals across Manitoba, the College of Nursing is doubling the annual intake of its graduate-level nurse practitioner program from 25 to 50 students this year. Cheryl Olfert, a senior instructor in the program, said over 150,000 Manitobans don't have a primary care provider, and that this role is increasingly being filled by nurse practitioners. Nurse practitioners also work independently across several health services, including community, long-term, and urgent care. Olfert said the need for NPs is particularly strong in rural and remote communities, and part of the expansion is an online version of the program for its winter intake, while the fall intake will continue to be a blend of online and in-person learning.
Nurses, when they take the program, value that in-person collaboration and engagement and learning. So the blended we still wanted to maintain. And so the design of the blended is also, we have students that are, 4 hours away and they're still coming for the in-person days. We try to schedule things so that it is accessible that way, but it makes it a little bit more difficult for, let's say, north or remote. So we have had students from Thompson come, but it is more difficult. So with the online, there will still be select in-person, what we're calling residencies, for things that need to be taught in person, so labs. But the majority of the program will be online so that they can be, in Churchill, for example, and still access the program.
Erin Ryback is a second-year nurse practitioner student currently in her final clinical rotation. She lives in Brandon, Manitoba, has worked as a nurse for over 16 years, and was drawn to the program to help with the shortage of primary care providers in rural Manitoba. She said one of the highlights of the program has been the support from her instructors.
I've loved being a student again. It's been so much fun to be in that learning environment. And I just, from day one, felt very respected by the instructors and the director and everyone involved at the university, because they really valued everything that I brought to the program as a person that has experience and expertise in certain areas of healthcare.
Thanks for joining us today. Please send any ideas and feedback to radymarketing@umanitoba.ca. Read more about this episode's stories by checking out the show notes or visiting our UM Today Rady Network news site at news.umanitoba.ca/network/Rady Faculty of Health Sciences.